नमस्कार म डॉक्टर संजीव सापकोटा ग्लोबल नेपाली health committee of NRN co-chairperson. So today I'm going to give you advisory on corona pandemic. Today, April 6, 2020. The next the real big picture, the real big advice to the global Nepali community for the next 7 to 10 days is going to be that the corona pandemic, the corona infection is going to be in the category 5 hurricane analogy, meaning the hurricane has different categories, right? 1, 2, 3, 4, 5. So 5 is the highest hurricane category. So akin to that, the corona infection is going to be category 5 for the next 7 to 10 days in the countries that has already the high number of infections. So my appeal, my advice to global Nepali friends and brothers and sisters around the world, and also to everyone for that matter, is to be very, very vigilant and very, very careful not to get infected. And people who get infected are not those people who do not know how it is infected, but they actually, even knowing that, and they probably sometime actually kind of negligent or just by without taking much of care, they tend to get infected. So we definitely have to be very careful the next 7 to 10 days, especially in the countries that have high number of the corona infection. You have to be very, very careful not to get infected. If you are infected, then definitely you have to seek advisors and medical attention. But those who are not infected, the next 10 days is very crucial that you take all the measures to not to get infected. So the major drivers of the infections are not those who are sick and not those who have fevers and all the symptoms, but those who do not have symptoms. People who get infected, but they don't have symptoms, not showing symptoms, and those are asymptomatic or pre-symptomatic. Those people think they are not infected, and then they feel they are healthy, and they go out in public, grocery and other places, in public places, and they unwittingly, they transmit virus to others. So the advice, again, is the next 10 days, stay away from crowd and stay away from grocery and stay away. If you just don't go outside. I mean, even if you have to do maybe, for essential matter, then cover your face and nose. Okay, the advice now is cover your face and nose wherever you go out of the house. I mean, even in the house, if you have somebody suspected or infected people, you wear masks, cover your face. The CDC guidance and WHO guidance is not look for surgical masks or other sophisticated masks, but whatever you can find, a cloth or whatever, just cover your face and nose, because that's going to prevent you from not getting infected. Again, those who are asymptomatic and pre-symptomatic, those who are not showing the infections, are the people who are actually spreading without knowing. So we have to be very careful on that. Again, cover with handkerchief or cloth or whatever you find. Again, the advice now is not to seek for surgical masks or N95 or, I mean, like for general purposes. I'm not talking about the hospital setting. For people, general public going out, the advice is not to go out. I mean, at all for the 7 to 10 days. But if you did definitely have to, then do cover your face, with whatever you find to cover with. Okay. Again, looking at the global numbers today, April 6, 2020, 1.3 million cases of infections around the world, and those are reported by different jurisdictions and different countries. And again, this 1.3 million, they are not exactly the exact number. They are always underreported. They are always the less than actual number is. So I really want you to pay attention that the number that you see, the number of infections, that they are always less than what exactly the number is. So 1.3 million could be, it could be very well 1.5 or even 2 million, exact cases. But reportedly to 1.3 million, and very sadly 72,000 deaths. But also the glimmer of the light and the light at the end of the tunnel is we look at the number of 2,073. 273,000 who have recovered. Okay, so there is a good chances of getting recovery as well. Again, the 70 to 80% of people who are infected, who do not have any pre-existing condition, they do recover, and we are showing by numbers like 273,000 have recovered. But look at the countries in USA. Very highly infected, 300,000 plus. Spain, Germany, France, Iran, increasing in India. Like we heard this morning that it's increasing by last in the last 24 hours, 1,000 people were tested positive in India. So it's growing over there. China getting to be stable, but still up there. But these countries, if you are residing in one of these countries, USA, UK, France, Spain, and Germany, Iran, and other places, those countries that have the highest number of the cases, you definitely have to be very careful for the next 7 to 10 days or even 2 weeks. Not to get infected. If you are not infected, then that's very good. Your chances of getting infected is very high if you are in these countries in the next 7 to 10 days or even 2 weeks or more if you do not follow social distancing, do not follow the safety measures covering your face and nose while you're going out. Don't go out, but if you have to cover face and nose, and kind of keep 6 feet of distance between two people. Again, if you are living in the USA, like you are saying, the New York, it started with the Seattle here in the Washington state, but then the different hotspot, the highly infected areas are, as you can see, New York, New Jersey, Chicago, Detroit areas are there. But now in the next 7 to 10 days, it's going to come down. Those that you can see those places where there are not as much cases as there are in this hotspot, New York, New Jersey, Chicago, Detroit. Those are gonna get stable, but then the infections are gonna come down, to places where there are not much infection. So, like the North Carolina, South Carolina, Georgia, Alabama, the East Coast, and Florida, you definitely have to watch for. Definitely have to be careful. Next, few weeks is going to be crucial. Again, I'm repeating myself. We are entering the category 5 in type of infections of the corona. The next, 3 weeks. If we get through that 3 weeks, then the very good chances of not getting infected after 3 weeks. But still, we have to be careful. But next 3 weeks, I appeal to the Nepali community everywhere, especially in the hotspot area. The USA, Spain, and UK, and Italy, Germany, Iran, and India as well, and other places. Take cover your face and mouth. Take all that you can to avoid getting in public, because people are getting infected not because they don't know and how it is transmitted. Either they are negligent, or they are not paying much attention, or they are not doing enough. We have to do enough, meaning that we definitely have to stop being in public, because this virus is contagious, very infectious. It has been detected in the air or the breath that comes out of the infected person, and chances of getting infected if you are near an infected person is high if you are not covering. Just cover. Okay. Again, Nepali the numbers, the people of Nepali origin around the world, how many of them are infected? Again, it's very challenging. We don't have the exact number. We don't have the exact sources, and people are not obliged to report and disclose the status. We are finding it's very challenging to find the exact number of how many of people or person of Nepali origin are infected. But we are doing best in estimate and getting in different sources. We are not looking for like names and all the identifying information. We're looking for aggregate information. So by all the sources that we have found that in the USA, at least 500 people are infected of Nepali origin, at least 5 deaths, 4 confirmed, 1 unconfirmed as of yesterday. In UK, many infected. The numbers around 100. Infected, 2 confirmed deaths as of yesterday. And in Spain, 18 infected. Portugal, 8 person of Nepali origin. In UAE, in Middle East, 10 in Dubai area. Bahrain, 3 and 3 plus, Kuwait, 4 plus, in Saudi Arabia, 4 plus, and those are again those are underestimate. They're always less than what the exact number is. Okay, in Nepal, we have heard that 9 people have been infected. Australia, many are in isolation. Confirmed cases, was at least 9 as of yesterday. So that's the the number of the Nepali origin. Again, this is underestimated. The people that we see low numbers, they are either zero or we don't have information. So those places where we do not have the infections of the among the Nepali origin, don't assume that they are zero there, but we know more than likely that there are cases, but we don't have information right now. Okay, again, we're trying best to get the numbers of the Nepali origin. Again, this is a map of Europe. Hotspot: France, UK, Netherlands, Portugal, Spain, Germany. Few days back, 4 people were infected there. Reportedly infected. But we definitely have to be very careful. These are the places where, if you are residing in one of these countries, Italy, France, Portugal, United Kingdom, Ireland, Germany. The likelihood of getting infected is very, very high if you do not pay attention. We all know how it is spread, how it's not spread, but we have to actually apply that to our life. And next, 3 weeks is going to be very crucial. The recent science has come out saying that the virus is detected in the cloth for at least 1 day, and in the max 7 days. If you breathe out the infected persons, using the max, and then the person, the max that used by the infected person, has the virus, and that can be detected after 7 days. I get a lot of questions. When is this gonna end? How long gonna last? The simple answer: we do not know. Because it's a new virus, new characteristics, new behavior, and any new virus, always we have to actually look into its behavior and epidemiology and all those. And it's very easy to say we don't know, but we do make a very intelligent scientific guessing on it's going to end. But I want to give you some scenario of 102 years back, when there was a great pandemic influenza of 1918, 2002, almost 102 years ago in 1918. What happened then? You can see the different cities in Philadelphia, in USA, San Francisco, St. Louis, and New York. And then the shaded areas are the number of weeks that they actually went into quarantine and isolation, social distancing. And then the graph, the spike, you see the number of cases, and each city is starting from the left to right. You can see, there's a spike, and then it has come down. A spike come down, and the shaded area is the area of social isolation. The number of weeks of social isolation. So I can read you there. In Philadelphia, almost like 5 weeks of social isolation. In San Francisco, almost 6 weeks of social isolation and social distancing. In New York, And in St. Louis, as you can see that after the social isolation, the curve has flattened. Okay, goes up, flatten, goes up, flatten. So when it's going to end, I mean, more we do social isolation, more quickly it's going to get slowed down. So again, the answer is still uncertain, but what is certain is more we practice social distancing, more we practice social, isolation. Be away from each other for at least several weeks. Here, back in 2019, back in 1918, 102 years ago, they practiced 5 weeks of social distancing, 6 weeks of social distancing, and that actually showed results, and the results were really encouraging. So again, the question when this pandemic is going to end is going to end one way or the other. Okay, but the matter is how many people are going to be infected before it ends, how many lives are going to be gone when this ends. The less, the more social distancing we do, the more practice of hand hygiene, and more careful we are, the better, the sooner it's gonna the slow down. um, it's going to slow down, but when the number of infected, the number of deaths, we can keep it to lower, if we are practicing all the measures that we are asked to do. um, Symptoms, we all know: cough, difficulty breathing, and fever, in both children and adult. But then we also have some body aches and sore throat. Not everyone gets it, but there was a study done among both the children and the adult of those who were infected, and then we found that majority of them had fever, cough, and difficulty breathing, shortness of breathing. But some also had diarrhea, pain in the abdomen, pain in the stomach, nausea, vomiting. Those are also are there. Not everyone has that, but some has that, both children and adults. And again, children are not spared. Okay, they are infected. I mean, the number of infections is lower among children, but don't assume that children are immune against this. That we can see that there are a lot of children infected here. Again, this is a graph of the children. We can see the black shows those children not hospitalized, blue hospitalized, and then the light blue is actually those who are in the intensive care unit. So again, children, majority are getting well after becoming sick, but then some do end up in hospital, some do end up in ICU. They are not immune. We have to protect them as well. Again, I want to end by this little Google Doodle, which actually says, actually thank all the health professional nurses and doctors out there, and all the healthcare researchers and public health workers. They're all to be thanked. We're all grateful for them, for the researchers, for the estimates they do. Whatever you do in lessening the impact of pandemic, in whoever are out there, researchers, journalists, and doctors, nurses, healthcare providers, and in the graphers and IT professionals, and whoever, social activists and social worker, health educationists, anyone who is helping reduce the impact of the pandemic. They're all to be thanked. And lastly, I want to point out that some studies has come out saying that those people who have BCG vaccination, those and then those people who had live in the malaria zone, they tend to be not in as much infected as others, and then some might also be protected. Again, they are very encouraging news. They are very great news, but we are not sure. We definitely are not sure about it. Hopefully that's true, and hopefully that stays that way. But don't assume that you have BCG vaccination and you are immune and you are free to do anything. No, you definitely have to practice all the social distancing. Good that you have BCG vaccination. Chances are you're getting infected is less, but still we have to be careful. Again, malaria, people who are in malaria zone, I know the less number are seen, but again we have to be careful. Again, the malaria medication, hydroxychloroquine, has shown some encouraging signs of like reducing the illness caused by corona infection, but not 100% sure. Again, the antiviral remdesivir used against Ebola. Those have shown some promising, the results as well. But again, we have to be, very vigilant, and we have to be, have to take all the measures. Again, with this, I am Sanjeev Sakura, uh, the chairperson of the health committee of NRN. I wish you all the best, and practice all the social distancing, all the measures. Again, next 7 to 10 days, and even 2 weeks or even 3 weeks is going to be very critical in knowing whether we're going to be infected or not. If we are not, because there are many people out there who are infected, who are not showing symptoms, and they are out in public places. We have to be careful. With them, and they are unwilling. They do not know they might be infected because they are not showing symptoms. Before they say so symptoms, if they come in contact with you, it's very unfortunate you get infected. So cover up. Let everyone cover up. Whenever we go out, whatever you find, cover nose and mouth, and that's gonna make a big difference. Thank you, and we'll come again.